Hello, welcome back everyone. Welcome back to the Festival of Health and Social Care. It's been a whirlwind day already. I've just rushed in and eaten a banana in 30 seconds after finishing the master lunchtime session. I hope you're able to get to some of those lunchtime sessions. All of the recordings will be available, so if you had to go off and do something else, they'll be available early next week. But I wanted to start off, and let's move straight into the afternoon panel session. This is a session around the challenges and opportunity that CareTech offers to drive transformation and improve outcomes. And I would really like to introduce you to Marc Greenwood, Head of Business Systems and Improvement at Coventry City Council. Give us a wave, Marc. Gareth Hillier, you have the longest title I think I've seen so far. Head of Digital Technology Performance, Business Improvement and Modernisation, and still got time to join us this afternoon. So thank you very much from Hertfordshire County Council. And Ed Willis, who is an advisor on the Care and Health Improvement Programme at the Local Government Association. Gents, let's ask you to unmute all your mics. Fabulous. Say hello to everyone.
Hello.
Hello.
Excellent. I'm going to start off. Marc and Gareth, you're also part of the ADAS digital networks in your regions as well. Do you want to say something about what you do as part of that before we move into the discussion more generally?
Yeah.
Gareth, do you want to kick us off?
Yeah, why not? Thank you. So, yes, I co-chair the ADAS East of England Digital Leaders Network with Sarah Rank from Norfolk County Council. And it's kind of, that group is sponsored by Nick Presmeg, the DAS at Essex. And it was really an opportunity to bring together all the local authorities who were grappling, as we know, with all the same things and, you know, share the same frustrations and try to look for ways that we could share some innovation, some of the solutions that we've driven, or sometimes just as a place to share some of those frustrations that we have and know that we're not in it on our own, really.
Does that echo with you, Marc?
Very much so. Yeah. So I co-chair with Abby Vella from the who's on secondment from the LGA to work with West Midlands ADAS, and yeah, very similar challenges to Gareth in the East of England. So I think we've talked previously with Gareth about potentially looking at opportunities for ADAS collaboration across our shared regions. So that'd be good moving forward.
Yeah, and I think when that was discussed, it was like the idea of getting digital networks from all across 9 regions. Is that right? You know, discussing and sharing ideas. I think, you know, this space, this panel discussion is hoping to sort of drive some collaboration, drive some sharing. So if anyone has anything that they think, any assets or any projects or any ideas that they think that would be useful to the discussion and everyone else here, please drop them in channel. It would be really great to sort of pick it, you know, there'll be a process of picking up the strands and the ideas afterwards. But Marc, can you sort of frame the challenge and the sort of situation you face in Coventry around, you know, the opportunity you see from CareTech and the reality that of actually delivering services day to day? There's a bit of a disconnect that you want to try and jump over, isn't there? Yeah,
I think that's a fair summary, Jane. So as local authorities, we're all experiencing the post-pandemic rise in demand now, and that is really starting to pinch. Coupling that with some of the workforce challenges we're experiencing across our commission services, we're all very well versed in the challenges from a social care workforce perspective, domiciliary care workers, residential care workers. So the challenge is very acute, if I'm honest with you. That it's that traditional rise in demand, but there's something additional about the rise in demand post-pandemic. There's a more potentially critical or urgent demand around the volume of work coming into social care at the moment. And then, as I say, couple that with the fact that pre-pandemic we had workforce challenges. I think those are now significantly increased. We look at the workforce challenges across other sectors that are affecting us. You know, HGV is not the only one, are they? But we are really starting to feel that pinch around the workforce and making sure that we get the right and the appropriate workforce to work in the social care sector to support the needs of our residents. And then I think there's something around the fact that we do have a very traditional model of care still. I mean, I speak openly across the West Midlands. There's still that very traditional approach to commissioned and provided services, and technology offers an opportunity, I think, and I think collectively colleagues on this call think there's an opportunity around technology to really challenge and disrupt the way that we do things, and really disrupt that traditional model of commission service and provision. And so really what we want to do was talk to you a bit about that today. I think what we can't lose sight of are some of the horizon challenges. So obviously the social care reform bill we've got an inkling of what's coming. That is going to create, I think it's fair to say, further challenges for local authorities and for the social care sector. As well as some of the benefits that are going to come out of there, there are going to be increased demands on already stretched services, and we need to plan for those and think about how we can meet some of those challenges creatively. We also need to think about the social care sector and the workforce that we do currently have, and look at some of those digital skills and capabilities of our social care workforce. And importantly, what are the digital skills that maybe our residents need to have to be able to embrace some of the care technology that's emerging on the market. So that's the challenge, I think, that's set. But we've also got to bear in mind that we have a huge opportunity here. So the last 18 months have presented the biggest challenge in a generation. I think it's talked about, isn't it? I think in several generations, let's be perfectly honest with ourselves. But also from that, we have had to embrace technology, and we had to do things in a very different way, from remote assessments, including OT assessments, as well as social work assessments, through to remote monitoring services and solutions that we're delivered in partnership with our health colleagues. The range of technology that we've had to embrace, and the fact that I think we work together as a group. I've never met Jane, but I've spoken to her and seen her an awful lot on these sorts of things. You know, it demonstrates that we can work in a virtual way, but there's also the added benefit of being able to work together and collaborate in a face-to-face environment as well. And that's absolutely the same for the cared for residents that we support on a day-to-day basis. So how we utilize and benefit from the last 18 months and our experience of those 18 months and how we've embraced technology, we need to play into that thinking around what does a modern future social care offer look like. And so linking into that, certainly thinking about how we maybe start to focus some of our efforts around, I'm particularly thinking around domiciliary care market, the home care market, and looking at what those sort of care innovations, those tech innovations are that we can really start to benefit from. And as I say, disrupt the current traditional models of care, because I think if we keep doing the same that we're doing now, then we are probably going to get the same outputs, but the same outputs are going to be having to increase with that pressure around demand and that pressure, if I'm honest, around post-pandemic complexity of residents that we're supporting. So that was a sort of the focus of the discussion that we had around a bit of a pre-meet of some of this stuff. And I think there's something that we can't lose sight of throughout this entire process and this venture, if you like. It's that ensuring that we take that person-centered approach. So we need to be able to use technology, and we need to make sure that we can benefit from technology in the broadest sense. And when I say we, I don't just mean local authorities or providers. I mean residents who are actually accessing and using our services. So I think care technology does offer an opportunity to really bolster and almost double up on the way that we approach our PI work streams, or the way that we deliver promoting independence and making sure that we can empower people to live independent lives as long as possible. And so there's something around the CareTech offer that enables people to live independently at home, whilst also providing that ability for their carer networks, family, friends, carer networks, to be able to actually support people in a more virtual way as well, and just have that use technologies and information and data to actually feed an understanding around people's needs and, importantly, how we can best support them collectively. And so that's where this conversation really led to. And I think there are many different providers and suppliers on the market that are starting to offer some of this. And I think that's one of the benefits and one of the risks that we've got around care technology, that the provision is constantly changing, and there's new things, there's new innovations out there. And the one thing that I said to the team on the call today last week was, I get quite frustrated with lots of ideas and lots of gizmos and gadgets, but actually it's sometimes our ability as local authority officers to be able to sit down, cut through some of the good and the bad products, but importantly be able to implement it. and actually do something different with the technology that's available, working in partnership with commissioning colleagues, working in partnership with health colleagues, actually working in partnership with residents who are using these services and these solutions. And it's really important to me that we actually try out and actually do something with this stuff, and not just almost become a conceptual discussion and move away from concepts and actually start to test and trial. And some stuff will fail. It will absolutely fail. And that's fine, right? We just got to learn from that. But we'll eventually get to a point where something really does make a difference. And that's really where I'm quite keen to work, as we just said, across local authorities, across ADAS networks, etc., to really come together, understand what works well in different settings, and importantly, learn from each other and potentially collaborate with each other to move forward on some of those agendas. I think it's really important when we think about ICSs that are coming on stream from the 1st of April, and what this means for genuine, holistic, person-centered support across health and social care. So as well as tackling some of those integration questions, I think it's got to tackle some of those demand and, importantly, some of those outcome challenges that we need to work towards as social care leaders. I'll pause there, Jane.
There's a lot of stuff in what you've just said, and I'll just, Gareth, tell us your sort of reaction to what Marc said. Is that something, is what he's facing, what you're facing too?
Yeah, absolutely. I mean, I think, you know, we all know that health and social care is a generic terminology that's bandied around a lot at the moment. And it can feel a bit, I think, and I'm sure others might agree, like social care can be a bit of a poorer sibling in the conversation, some of the discourse and certainly the activity. And I think there's so much kind of pent up enthusiasm. There's certainly the demand that Marc's talked about to do something in this space. And I think only now really, and I see it through the network particularly, that people are starting to get some kind of realistic and coherent thoughts together about what some of that disruption looks like. They've got some more realistic expectations about, you know, what works with the people that we provide services to, the extent to which you can interoperate or integrate with an ever-changing system, seemingly. I mean, I'm sure other people feel this as well, but as a local authority within the system, however you define that, you know, the boundaries you can draw a million different times. It could be with very local kind of provider partners, it can be with health partners, it can be with a region, an ICS, you know, all those kind of things. So I think that's very, very complex to navigate. I think as well that something that's kind of defined the last few years, possibly more in terms of social care technology, has been the fact that business as usual has been quite tricky. It's quite hard to keep up and to be able to respond to legislative change and kind of disruptive, transformative stuff that Marc's spoken about actually feels quite complex or risky, costly, etc., and probably feels a bit too big for a lot of organisations. So I think to kind of take on a lot of that true disruption, I think those cemented relationships within ICSs are absolutely critical if we're going to have access to the right people, possibly some funding, and the ability to progress. I'll touch on that, but also the networks that we have. I mean, the East of England network that we have for ADAS digital leaders is that place that I spoke about earlier, where people can share the problems, but they can also share some of that responsibility of being risky, and some of that collective bravery that comes with that. So I think there's lots of opportunity there that I think we need to tap into. I think we need to shake some of the shackles that we've had for years, that a large part of the kind of social care, the people that we support in social care, a large part of that market have not been typical adopters of technology. I think increasingly they are actually. We've probably seen a lot of that as a response to COVID, where various NHS kind of apps and things have been adopted by people. but also, you know, playing back to Mark's point, that section of the population that are excluded, digitally excluded, we need to think about ways that we touch on them. Many things, I suppose, that I'd add to that is one of the things that we've experienced is the frustration of not having perhaps a longer term digital strategy for social care. And that's largely because we're defined year-on-year funding arrangements. You know, we're defined and waiting for the system, the ICS, whatever it might be, to mature and develop to a point that we can kind of reflect the system needs, etc. And I think some of those things are starting to change now. I think some of those bits of maturity are developing. I know Ed's going to talk a bit about possible funding changes, etc. So kind of in summary, I suppose, you know, I'm a desperate kind of proponent of us not all reinventing the wheel in our silos all the time. I'm absolutely desperate for that. The effort that we put into that, and it feels like it's additional effort sometimes to share, to find that space, to network with people, to learn what's going on, and to use some of the great work that's happened elsewhere. But there's so much sense in that. So many of the conversations we have at Eastern region, we discover that probably any business case in a digital sense that any of us have written in the last 3 or 5 years, 80% of it has probably already been written somewhere else, just over a border. Doing that collaboration and that networking, I think, is absolutely critical. I think taking some time to develop just a bit of trust and maturity in those relationships is really important. We're very lucky that we've got really good commitment in our regional group from, you know, regional and national bodies. And looking at Ed, I suppose, from the LGA, you know, NHS Digital, increasingly NHSX, etc. I think that's a good opportunity to drive that collaboration where you might not get it as an individual within that kind of complex system. And I'm just looking at kind of the other bits. So I suppose the other things that I think, one of the things that I'm desperately keen on is driving some kind of standardisation across the system. And I think that that's one of the biggest barriers to individual local authorities, particularly the sector, because we do things also time in agreeing some of those things, and investing time in doing that around standards, you know, practice governance, information governance, I think is critical to this. So yeah, so I think that would be my summary, I suppose.
Perfect. We lost you a little bit sometimes there, but I think we caught you up, and we all got the most 95%, 97% of what you said. It's all good. I think it sort of feels like from both of you, it's like a perfect storm or perfect opportunity. You can take it both ways of, you know, now consumer health care tech is out there, people are using it. You know, how do you leverage that? How has COVID, as you said, Marc, you know, that just sort of turned everything on its head in terms of assessments. I know you're part of the Digital Care and Support Assessment Project and LPS as well. You know, that they're solutions that are trying to drive more self-service. You know, I think people expect it as well. You know, those generations, those people coming into the system expect a bit more, you know, digital interface to do some of this stuff to get their answers. So it seems like a good time to be tackling some of this stuff. But you know, it's that balancing, isn't it, of the traditional forms of care, which need to be safe, and you're supporting people, thousands of people across the community. But how do you disrupt it? How do you make people change? Because it's not just the workforce, it's residents as well, isn't it? Wanting change and not just wanting care given to them, but to be participants in that care. I think that's quite a challenge as well, isn't it? Oh, Marc.
Yeah, I think that we can't underestimate the cultural challenges that we're going to face, and not just with our residents, but as I say, with our providers as well. So the fact that we're probably going to want to have a different conversation around how we commission and pay for services and what we expect in terms of outcomes for those And that's a huge transition, I think. Anyway, that's a huge transition from where we are now in some of our more traditional approaches to commission services, and importantly, maybe how we incentivize around some of that. So I think, yeah, you're absolutely right, Jane. There are some huge opportunities. It is the perfect storm, but the time is now, and we have to absolutely capitalize on this, because with the reform agenda a couple of years away, the fact that we're coming out of the pandemic, but we're entering possibly the worst winter that people are predicting in God knows how many years. If we don't capitalize on this time now, if we don't give it a go, then I think, you know, it'll be a missed opportunity.
Picking up on what you've both said about, you know, Marc, you were talking about the different all the different solutions and different care tech that is now out there, and Gareth, you sort of saying that there's a business case probably for everything that you're looking at somewhere else within local government. I think, yeah, I don't know, Ed, you've probably got a view on this, and I'll come to you next. You know, how do you share those business cases? How do you tell, you know, the better telemonitoring system or the better sort of FOHSC app? You know, how do you share that information with each other? That seems to be like a missing piece in amongst all of this. Again, if anyone who's listening here has project outcomes, has business cases, has anything they've been involved in, we'd really love to hear about it. Ed, you've driven the Social Care Digital Innovation Programme, which the SCD was part of. There's lots of good learning out of that, isn't there, that you're sharing? How do we share more?
Yeah, absolutely. I mean, I think the Social Care Digital Innovation Accelerator program was a good example of councils coming together and working on a common problem, so that gets over some of that silo aspect that Gareth talked about. You know, as an LGA website, we put up the resources and learning and case studies that come out from projects like that. But I mean, around the business case side of things as well, we also host the Knowledge Hub for care technology, and already there's business cases, there's care technology digital strategies that councils can put up. It's a lockdown area, so only councils can access that, which, you know, will alleviate some of the concerns about commercial sensitivities. So that's a resource, and, you know, we can share that in the chats, and as you really sort of advocate for that. It has to be a case of councils and regions coming together. I mean, Gareth and Marc are both in regions that have really active ADAS digital networks, and that's emerging in other parts of the country as well. But there was so much touched on by Marc and Gareth earlier. I mean, just a few thoughts that came to mind. I mean, I think one of them which is key, is that I think expectations have risen in the sector, and quite rightly. I think people are used to using this technology in their everyday lives now, and, you know, we as a sector need to respond to that. It's not just, I think, about care technology bringing the bare minimum. It's got sort of a capacity to give real joy to people. And we touched as well about the reform bill and the challenges that might mean. It certainly, I think, will increase demand in the sector for care assessments, for financial assessments. So just in terms of managing that, we need to have sort of more digital, more self-directed ways of supporting that for people. We also talked about the fact that getting all these systems to talk to each other is a real challenge as well. And I think that's really recognised, you know, in the sector, in our partnership working with NHSX as well. The other social care team really get that need. And I think one of the tasks in the sort of coming months really will be translating what good looks like, which has been made available and clear at an ICS level, translating what that means for adult social care, so that it's a really integrated picture. And, you know, meetings like today, where it's about councils coming together and co-producing that and sharing learning, will be key to getting that right as we take that forwards. I think the other aspect that was mentioned in sort of working with ICSs is that sort of remote monitoring approach that we're seeing in health. We're at risk, I think, of local government social care being seen as the junior partner or the poor relation. I think that has been the experience to date, but I think there is real opportunity now with the prospect of a 3-year spending review to have a bit more of a longer term approach to this, joined up health and care agenda, and make it really preventative. Focus on self-funders, focus on those people that can benefit from intervention earlier on, and avoid, more extensive costs that can be avoided. So I think it, just echo the conversation about this being a real opportunity, and just in support of this, to highlight that the LGA's Care and Health Improvement Digital Programme will be kicking off the launch webinars on the 12th of October, and we'll be inviting expressions of interest from councils interested in supports in these areas. I think we talked about the capacity for change in some of this, and difficulties in terms of just keeping up with what's business as usual to some degree. I think one aspect of the programme will be around digital leadership, and that being the case at senior as well as operational levels. So that will be part of the support offer that we're looking at. And then some of the themes as well. Mentioned about working with the care market in terms of adopting technology and looking at a more outcomes focused approach. That's going to be a real change. That's going to be something that we're considering. Digital discharge to assess and managing that flow from the acute sector, getting towards a more population health approach so that it's not all about hospital admissions, and managing that, we can get upstream of that. Making the benefits realisation case clear is a really important thing. As you say, there are good practice examples from pilots that have demonstrated some of the benefits, but there's a real opportunity to bring some of this together. And lastly, and I think most significantly, making it digital access for all. There are particular challenges of digital exclusion, particular groups that find this more challenging, whether that's for reasons of income or culturally. And providing that sort of information advice offer that can and equipment access that's needed can begin to make the difference and address those changes. And lastly, I'd just highlight in terms of an opportunity, the digital switchover that everyone is having to sort of respond to by 2025. It's a complex area, but it does mean that there's a pressure that we need to change and sort of adopt new digital ways of working as well. So all of these things, I think, come together and help make that case.
Brilliant. Thanks, Ed. That was, again, a big load of stuff to take in. I mean, I think what's interesting on the sort of digital exclusion piece is none of these systems are developed for everyone. They're all developed for, as many people who can access and use them as possible, which sort of alleviates the demand on the resources to actually give better face-to-face responses and support to people. And I really think that, a lot of the stuff that's come out of the skid era and stuff actually helps that. But Marc, you had a particular point around the resources and the capacity within your system to actually embed these new systems. So I know care and support is something that you're looking to embed. I know you've embedded DOLS, if I'm right. But that takes a lot of time and winning hearts and minds, and training and getting people up to speed, and to understand that I'm not trying to put you out of a job, but to help you do your job better. It's a real challenge, isn't it?
It is, yeah. We've not implemented DOLS yet, partly because of those challenges.
Okay.
But we are going to do. We are going to do. I'm determined before Christmas. So yeah, absolutely, Jane. One of the things that I suppose I get frustrated with, but also have to reflect that we don't always have the right capacity and time to be able to do these sorts of big changes. Because everything we've just talked about for the last 30 minutes or so, this isn't easy. If it was easy, we'd have done it ages ago. So we've touched on the cultural challenges associated, the culture change, the fact that actually some of the approaches that are starting to emerge around the use of care technology tend to challenge some of our traditional ways in which we have managed risk around residents. Social workers, my principal social worker, he always says to me, we were trained to be risk averse. That's the way social workers are trained still. So we've got a real challenge there to work collaboratively with professions to actually think about how we get the best use out of care technology, but importantly, how we manage risks associated with the change process, particularly to residents, but also to our workforce. And so I think there's that shouldn't be underestimated. And within that complexity around the sort of the change cycle, there's the capacity to do some of this stuff, right? And what I mean by that, I hate it when people say to me, I haven't got capacity for that. I haven't got capacity for that. But actually, this is such complex, difficult stuff that it needs you to be able to pull out of the day-to-day and to really focus efforts and resources at making the change happen and really embedding the use of care technology. And often that's why I think care technology projects either fail or maybe don't get the full benefits out of them, because that adoption process, the technology adoption process, hasn't been given enough respect often, and importantly enough time. So I think there is as well as that growing opportunity around sharing what works well, and often, Ed's talked about some of the resources that are available, but let's be honest, a lot of the time it's word of mouth. So speaking to people like, oh, I heard that so and so is doing this really well, I'll give them a ring. And actually that's good, that's really helpful, but it doesn't always give you then the next stage of, okay, so that's an idea that I've got, how do I take it from an idea to actually a prototype in my organization and beyond? Yep. And that's where that resource and that culture change and that real change management piece comes in for me. And that's where I think there's potentially a greater opportunity for ourselves across this network or across our ADAS networks or wherever through the LGA, etc. Maybe there's something about how we come together to be able to share resources, importantly, and really put some effort behind delivering some of the change that's needed. And transformation is often a bit of a dirty word these days, isn't it? Because it's so overused. But this is about service improvement. This is about service change to deliver better outcomes for residents, whilst also meeting some of those huge challenges that we have on the horizon around our workforce demands and, importantly, some of the reform agenda that's coming on stream. So I think that's the bit that I really want to try to start to unpick over the coming weeks, is how do we genuinely work together as organisations to share some resources that can actually deliver practical change that we learn from together, and then we build momentum behind to deliver long-lasting improvements.
Yeah, I think, certainly, I don't know if you're on this morning session, but, out of the 4 projects we highlighted, 2 of them had implemented the digital solutions and could absolutely stand up and evidence the business case and the benefits that they were people right across the system, from patients to their workforce and senior managers were experiencing. And then the other 2 were really keen and had been involved in the collaboration and saw all the benefits of doing it, but just as you say, Marc, just didn't have the capacity to implement the solution as yet. So I guess in this session, and CC2I is all about collaboration and trying to make these things work a bit better. I guess we're quite keen to pull together a collaboration that tries to build that resource, to try and build some implementation or additional resource that councils can pull on. And I guess don't really know what that looks like right now. Usually we do digital solutions and we know what it looks like and what the challenge is, and we can get a technical partner and build something. But definitely, this is a problem that everyone said today. You've told us before, Marc, and you're sitting on 2 great solutions that you want to deploy. How do we help you with that resource, bringing in the right people to do the internal training, make the business case, help you just be the strategy person and get to the right people and have the right conversations, but give you the sort of intelligence and ammunition to do that. So yeah, let's say as one outcome of today, that's what we're wanting to do. So hopefully you'll be part of that and you can help us work out what that is, and we can bring other people together. Gareth, you're nodding. Tell us what you think about that and workforce in general. I mean, you said particularly last week around the conversations are really hard and you have to have them with the right people, and echoed this morning, if you don't get the right person, the right sponsor, you just can't drive it through.
Yeah, thank you. Interestingly, I was thinking particularly about some of the things that Marc had just said, and I suppose for me there are the two things of that collaboration, networking, sharing, etc., that you've just spoken about, Jane, that I think are really important and probably a bit distinct. So there's the opportunity to kind of share some of the conceptual stuff, business cases, ideas, etc., which I think is really, really important. But I suppose where the real activity happens, where that dirty word stuff actually is seen and felt, is quite often where there are those small pockets of work, those tiny in kind of initiatives that people take on, and the workforce and the population feel a bit of that change, and it feels a bit of a shift, and we see that in lots of different sectors, and certainly that's been some of the most powerful takeaways that I've had in the last couple of years in some of the work that we've done in Hertfordshire, where we've perhaps been surprised by putting a tiny bit of tech in and working closely with the people working with that new information or whatever it might be, that they've really embraced it, and they've almost kind of shifted some of those models of delivery and some of those pathways that they're using on the back of that. And people are very intuitive, and they're really keen to do the best they can do and the most they can do. And I think coming back to Marc's dirty word, it's avoiding kind of badging stuff transformation and scaring people off, because we're bringing this very scary thing to your door, whereas actually we're bringing something that we hope might help. We want you to embrace it, and we invite people in to do some of that. And that second bit, I suppose, about the culture shift, and I can think of a load of examples in Hertfordshire. I know that Rob Creary's on the line. We kind of implemented the medical interoperability gateway into the Hertfordshire social care system, and only with a small amount of staff. And it kind of just brought stuff to life, particularly with the COVID backdrop, and seeing people that have been vaccinated and things like that. But it totally transformed how some of these people were working and things. And how we can share that second bit, the impact it's had, the culture shift, what's been embraced, what hasn't, etc., I think is key.
Ed, you were telling us a bit more about the work that NHSX is doing around adult social care. Is there any sort of updates you can give everyone around what might come from the centre, or how partnership working with the centre, can become stronger?
Yeah, absolutely. I mean, I've got to be a bit wary of
Sure.
saying stuff. So now working in a sort of combined role between LGA and NHSX, but I mean, as I say, the adult social care team within NHSX really do get adult social care, really do want to work with local government and make sure that they're fully partners in ICS arrangements. I mean, I think it's worth reflecting that integrated care systems are the way that the sort of sector's going in terms of funding arrangements. And one of the projects that we've seen recently is focused around digital social care records and introducing that with care provider partners. And in 9 ICSs, we saw those that were successful taking a local government-led approach to those bids. And I think if that can be replicated, and we can see that in the sort of coming weeks as opportunities are due to launch around digital social care records, around technology to support falls prevention, and the infrastructure behind that, making sure that local government in your local systems, and it's not straightforward, local government councils are in different places in different parts of the country, but that provides the opportunity to really sort of get at the forefront and to have the have that sort of funding opportunity to push things forwards. I think as well, NHSX recognised what Marc was saying earlier about actually there's capacity that's needed to implement some of this change implementation support needs to be part of the funded package. It's not just about tech. It's understating it to say that the tech's the easy bit, especially with, I know, all the hard work that, you know, in various CC2I projects, technical partners have delivered. But actually, it is that cultural change piece that need to work with operational colleagues and really have them understand and benefit from, you know, the solution that takes the time and energy. And I think an approach that can sort of focus on that is absolutely key. And as I say, it's something that NHSX recognise in terms of the funding going forwards. I think as well, there's a recognition that we need to move away from a sort of overly focusing on acute and actually think more widely about the population health approach, about supporting people in their homes, and technology and innovation around housing as well. So these are all things that are really under active consideration, and with the, you know, benefit of a 3-year program we're expecting for the spending review, it gives time to make those changes. And I'd also just highlight, I mean, Marc mentioned that actually, you know, these things take time and energy, and on top of the business as usual, as Gareth says, sometimes it can be hard to find the time to bring the stakeholders together. Just a reflection on the source of care technology self-diagnostic tool that the LGA have. That's available to councils to come together to use, but really to take advantage of it. It requires getting, you know, a substantial team of people together, operational staff, social care professionals, occupational therapists, more senior staff, and directors coming together and actually dedicating some time to it. And that can be, you know, half a day, a couple of half-day sessions. And that's, you know, where the sector's under pressure, that can feel hard to achieve, but the benefits really flow from that, because then everyone's involved and it can push that sort of sense, for want of a better word, of transformation to enable that to happen. But it is an investment, and it is something that NHSX recognise.
I think time's the key thing there, isn't it? It's time. So the time is now, and the time to implement stuff is so long, and the capacity, the time to get people together to understand what the offer is. It's all about time but pace as well. And yeah, just that there's not enough time in the day, I guess. Marc, have you got anything you want to say around time, around sort of budgets? There was something, you know, I remember you said about the funding, you know, there's new funding been announced in the last few weeks, you know, how long that will take to actually get to the front line. I think that's sort of an interesting point to raise. And I think equally, Gareth, you know, going back to your point about, you know, the frontline, people on the front line being heard in terms of these digital approaches and those small wins, I think that's really interesting. And I think that goes back to something that was said this morning, you know, that it took Paul 8 years to get his idea to actually be a digital solution that's now being deployed across the West Midlands. And whilst that seems like a ridiculous amount of time, and, you know, now's the time that everyone's ready to understand that, you know, this data-driven approach is appropriate and we can do it legitimately with IG and all of that. So, but, you know, it's about being heard on the front line and bringing everyone with him in particular. But as well in Sunderland with the automated telephony, you know, they've deployed it and the people are already seeing, you know, benefits to their sort of skills and their conversations that they're having, and immediately having an effect right there on the front line. So we know digital can deliver, but yeah, we need to do something more about time. Go back to the funding point. I went off over here into time and back over here. Marc, take it away.
I think the Gareth bit's going to sound more interesting, to be honest, so I'll keep this short. But I think the funding bit, I think what we need to do is work closely with colleagues at the LGA, NHSX, and where the funding partners are really sat, to come together and work as a group of organisations to actually put bids together, to then be able to go through the process of getting the right funding for the right projects, and then importantly, going back to that point around capacity, building the resources in that can, genuinely enable local authorities to deliver the change that's needed. That's what I'd like to see as being able to do in partnership with other local authorities, is coming together, but importantly working closely with colleagues at the LGA and NHSX to shape how we might best do that. I probably won't say anymore. I think we talked about the complexity of it all enough and the resources that are needed around the change process. I mean, if we can crack that nut, that I think will be a massive step forward for us. So yeah, I think that's probably something for us to pick up outside of the festival. So I'll hand over to Gareth.
Yeah, thanks, Mark. Just on that funding point, I suppose the thing that we hear most often, particularly in the Eastern region, is that the opportunities for funding are designed in such a way that it always feels like you're in competition with all of your peers in the area. So, you know, you're trying to elbow your neighbouring councils out of the way to access some funding to do something, where what we really want to see is councils coming together in forums like, you know, the ADAS networks, etc., all expressing a bit of a view, you know, championing the fact that one of their peers is going to be leading the charge on this, knowing that there's going to be a wake from that project that we can kind of ride and hopefully kind of streamline ourselves into some of the opportunities that creates. So, I mean, that's a massive thing. And as a cultural thing for local authorities moving away from this, that's definitely something that, you know, I really encourage, because it does seem silly to be in competition with each other. And just in terms of that, kind of getting the front line engaged, I suppose there's two things that I see with that. One of them I've already mentioned, which is about letting the front line feel the impact, letting them kind of embrace and feel their way with new opportunities and have that opportunity to feedback. But the most important bit, I suppose, is just that what we might think of as practice governance, other people might call it something different, but having established governance within the local authority for and wider, because there's a co-production element to this as well, but having that governance that enables views, wishes, perspectives to be heard when you're putting together the design of these kind of things. And that, you know, I mean, that's so important, isn't it? And there has been historically, I don't think it's been a recent thing, but there's been a historic thing where health have been guilty of it, as well as local authorities, that the path of least resistance is just to do unto people. Actually, we'll find it and we'll just kind of roll it out and do it to them because it's easier, and we'll deal with the fallout when it happens, and just hoping that people will toe the line and they'll adopt some of these things. So that co-production piece and that practice governance bit is just critical, and that needs to happen across wider patches than just within the local authority, but the local authority bit is really important.
Yeah. I mean, I think, you know, that's absolutely right. The Scadir, and Ed will nod as I say this, you know, we tried to make the application to the Scadir as simple as possible. It took, I think, half an hour, and it really wasn't trying to pitch local authorities against each other for a single pot. It was trying to bring as many in as possible to, you know, share ideas and bring them together to help, you know, co-design and co-fund. So everyone's part of the project for, you know, a part of the cost, as it were. And equally, it took that responsibility of you know, the build, but also the sort of scaling. I think the scaling is the key thing. I know in a lot of the SCIDIT projects, you know, something's been built, but it's not in the local authorities, you know, remit to sustain it and to make it available to others. So the SCIDIR, I'm hoping Ed, you know, sort of tried to change that model, didn't it? You know, in bringing together the 30 across all of the projects and involve everyone and it not be a rival competition.
Yeah, absolutely. I think that sustainability piece is really key, and you're right, it is a challenge for councils to sort of sustain and maintain a system on behalf of the whole sector, and I think, you know, councils coming together is the way that can be managed, and whether it's the SCIDIR approach and working with CC2I, or whether it's regions coming together at an ADAS level. You know, there have been examples with the PAM system that's been adopted in, I think, more than one ADAS region now. You know, that's the way that you can sort of get the scale that's needed. And just reflecting as well, I mean, I'm sure Marc will speak to this, but when Gareth mentioned about the need for a more sort of collaborative approach when it comes to sort of bidding for monies and things, I know in the Midlands there's a real coordinated effort in response to the opportunity around digital social care records, which made sure that there wasn't wasted effort in the region to access those monies, and had the sort of quid pro quo that they'd be sharing for the region from those councils. So that's one way that you can make it work. And also, I mean, I mentioned some of these opportunities around digital social care records, falls prevention, etc. You know, there will be a launch of what this funding opportunity means and looks like on the 18th of October. And that will be for up to 12 ICSs. But the intention is that this is a trial run, a sort of test of a general approach to funding through ICSs that makes it available to all. So you're not having that sort of competitive element in quite the same way. And you're making sure that funding is actually starting to track population needs a bit more in terms of how the sort of quantum of funding is made up. So these are the opportunities that we have with a sort of more longer term spending review settlement, but it's in the here and now. We don't want to lose this sort of sense of momentum that I think all councils have acquired in response to the pandemic. And you know, some of the pressures that are just immediate that councils are having to change with the digital switchover. Actually, this transition's happening now. It has to happen before 2025. So this element of pace is something that, again, the LGH Digital Support Programme, we want to be supporting. And as I say, communications further on this next week, and the launch webinar on the 12th of October should give councils the opportunity to get involved. But you know, we'd be really excited to see councils coming together as part of this. That will be one of the aims of how we've designed the programme. And again, Gareth talks about co-production within councils and more widely. You know, one of our real aims and ambitions is to make sure that we're co-producing with councils in our support offer. So your feedback on this support offer and approach is as important as the delivery.
Brilliant. Well, that's the first step then, isn't it? 12th of October, you say, Ed. So there's a funding opportunity there. I think, you know, we're very clear we're interested in pulling together a council collaboration around, you know, that resource and capacity issue to try and help now. Let's see how, you know, should we, you know, focus that on a digital solution? Should we focus that on unpicking one and deploying one and understanding how that all works? So we'll all have to sort of work that out over the next few weeks, but we will go out to everyone on that shortly. I think there were a couple of other things to take away that you mentioned the other day, Ed. There was some Ipsos Mori TSA stuff that might be of interest to people.
Yeah, absolutely. So NHSX commissioned a couple of rapid evidence reviews that reported in March around digital technology in the adult social care sector and the skills piece. So on the back of that, there's been a more comprehensive review undertaken, and the draft findings for that are being shared now for publication, finalisation in October or start of November. So that will be something that will contain recommendations. I mean, some of the findings I think will not be too surprising in terms of the need for resource, the need for skills development, is particularly amongst care providers, the fact that it's quite a diverse picture. I think one of the findings that we've seen is that actually just making a start, deploying some technology actually builds digital confidence. And, you know, that rather than it being a sort of theoretical activity. So that's a sort of learning and recommendation that can be taken on board. And I think, you know, from this conversation, we're sort of demonstrating actually let's get moving on stuff, and that can help. And then you mentioned as well TSA. So the Technology Enabled Care Service Association have been collaborating with ADAS on the Technology Commission, which came up with some recommendations for the sector to really promote all the good things that we've been talking about in terms of independent living and improving people's health and well-being through technology. And a set of regional webinars, virtual events are being planned in November dates to be confirmed, but we'll share with this network, to just further that discussion around those recommendations, and also think about how we can plan better as a sector for the digital switchover, for that sort of more proactive, predictive approach to care technology than some of the more responsive services that we still have in the sort of analog world.
Brilliant. There looks like there's stuff going on that's going to help people on the journey. Marc, do you have any sort of closing comments? I recognise we've got like 4 minutes left, but you're part of the digital network. We want to make change. You want to bring people with you, I take it. So is it just that we should do this, and let's be in contact with each other and bring something together, keep the discussion? I don't know.
Yeah, I think that'd be really helpful, wouldn't it? I mean, I think what we've talked about today, and hopefully colleagues on the call have sort of agreed with us. I've not seen any dissenters, but if you don't agree with us, do let us know. Because I think there's the next stage to this for me is, it's exciting, the stuff that Ed just talked about in terms of some of those funding opportunities that are going to come on stream. So I think there's an opportunity outside of here to look at that, what that looks like, how CC2I can support with some of that, bringing some of the regions together, like Gareth and I have talked about for an ADAS perspective. Importantly, what I'd really like to see, and it's something that Gareth touched on earlier, I'd really like us to start to have conversations with real people about some of this, because it's great that we sit in our little ivory towers and we think it's wonderful what we can deploy. But actually, at the end of the day, if it doesn't make a difference to somebody's life that we are supporting, then there's not an awful lot of point in doing it, because they won't embrace it, they won't adopt it, and it'll just fail. So I think that's there's two next steps for me. Let's get together and look at what the opportunity around genuine collaboration may be from an organizational perspective. And then I think there's something about how we start to have conversations, and maybe it's building on some of the work that Ed's talked about, but have conversations with real people about what they expect from their lives in the future and how we can work together to make that a reality.
Brilliant. Yeah, definitely in the virtual support, project, having service users there, leading it. It was great to have the people from the local authorities, but actually they were the ones who really said what they wanted. And it's, the digital, approach is that much better because of that. Those conversations are vital. Absolutely. Gareth, final comments?
Yeah, thank you. I mean, Marc summed it up very nicely there, didn't he? I suppose just encouraging that continued kind of networking and collaboration, because it is so important. And, I'd encourage people to think about a time when someone shared something with them and they thought, oh my God, that's exactly what I'm doing. That's going to really help us. And if we can do that with each other, then, why wouldn't we? I know it takes a bit of time, but let's invest in that time. And the only other thing, just to really quickly pick up on Ed's point, which there was somebody that I worked with within the NHS who was talking about kind of giving people a bit of tech and watching them kind of run away with it and watching it kind of work its magic once they've got it, rather than spending a lifetime designing it in a kind of darkened room. And he talked about the fact that, his 3-year-old daughter would pick up the iPad and she'd make her way with it. And he would never sit down with her and try and design what an iPad should do or look like for her. She would just make sense of it. And I think people are a bit like that. And let's embrace a bit of ingenuity and,
Absolutely. Yeah, absolutely. I guess for, as a parting comment to everyone, if, this has inspired you, this conversation, if you want to be part of collaboration, then get in touch. It's, it's not just about CC2I, it's about everyone here and other networks, but we're happy in this instance to, bring together and share what we can, and then share into those other networks and try and move this all forward. So I guess with that, I just want to say thank you all, gentlemen, for taking time out of your very busy days, and thank you for your insights. I really hope this sort of moves us on, and that we can reconvene and have a bigger conversation with more of the people that have been here today, and others that will follow on. Thank you very much, everyone, for joining us at the festival today. That's it. We're done. I'm going swimming.
Thanks, everybody. Thanks, Jay. Thanks, Sam.
Thanks a lot. It's really nice to see you.
thanks all.
See you all. All the best.
Take care.